Allergies and pink eye are common conditions that can cause discomfort and irritation in the eyes, but they stem from very different causes and have distinct symptoms. Allergic reactions in the eyes are often characterized by itching, redness, and watery discharge, typically caused by irritants like pollen, dust, or pet dander. In contrast, pink eye, also known as conjunctivitis, may present with similar redness, but is often accompanied by a gritty feeling in the eye and a thicker discharge that can be yellowish or greenish, indicating a possible bacterial or viral infection. While allergies are typically treated with antihistamines, decongestants, or allergy shots, pink eye may require antibiotic or antiviral medications, depending on the underlying cause. Individuals with a history of allergies, or those frequently exposed to potential irritants, are at higher risk for allergies, whereas pink eye can be highly contagious, especially the viral and bacterial forms, affecting those in close contact environments like schools or daycares. Here's a detailed look at the intricate aspects of these two conditions to better understand their differences and management. Cause of condition: immune response versus infection. Allergies and pink eye, conjunctivitis, might have overlapping symptoms such as redness and itching in the eyes, but they stem from different causes. Allergies are an immune system response to various environmental triggers like pollen, pet dander, or dust. When exposed to an allergen, the body releases histamines, which lead to inflammation and symptoms commonly associated with allergies. On the other hand, pink eye can be caused by bacterial or viral infections. In bacterial conjunctivitis, the symptoms include a sticky yellow discharge, whereas viral conjunctivitis may produce a more watery discharge. Distinguishing between these two conditions is critical because it affects the treatment approach. Allergies are often managed with antihistamines, while bacterial pink eye requires antibiotic intervention, and viral conjunctivitis typically resolves on its own with supportive care. Primary symptoms: sneezing, nasal irritation versus eye redness, discharge. When distinguishing between allergies and pink eye, the primary symptoms offer critical clues. Allergies typically trigger sneezing and nasal irritation due to an immune response to allergens like pollen or pet dander. Accompanying these are often itchy, watery eyes, but the discharge tends to be clear. Conversely, pink eye or conjunctivitis predominantly features eye redness and a possible discharge that can be clear, white, yellow, or green. This bacterial or viral infection may cause eyes to stick together, especially upon waking. If itching is more prominent than soreness, lean towards allergies, whereas distinct eye goo suggests pink eye. Common triggers: pollen, dust versus bacteria, viruses. Allergies and pink eye, also known as conjunctivitis, can present with similar symptoms such as redness, itchiness, and tearing of the eyes, making it challenging to differentiate between the two without proper understanding of their triggers. Allergies are typically induced by allergens like pollen and dust, which cause the immune system to release histamines, leading to inflammation and irritation. On the other hand, pink eye is often caused by bacterial or viral infections. Bacterial conjunctivitis tends to produce a thick, greenish-yellow discharge, whereas the viral type may accompany a cold or respiratory infection and usually results in a more watery discharge. Recognizing these distinct triggers is crucial for accurate diagnosis and treatment. Antihistamines for allergies and antibiotics or antivirals for bacterial or viral conjunctivitis, respectively. Typical duration: seasonal, chronic versus acute, temporary. Allergies and pink eye conjunctivitis can both cause discomfort and redness in the eyes, yet they differ significantly in duration and underlying causes. Allergic reactions are often seasonal, linked to environmental triggers like pollen, and can become chronic for individuals with ongoing sensitivities. Symptoms typically persist as long as the allergen is present. Conversely, pink eye is usually an acute, temporary condition, often resulting from bacterial or viral infections, and typically resolves in a few days to 2 weeks with proper treatment. Understanding the duration patterns helps clinicians differentiate between these conditions, informing more targeted management approaches for each. Usual treatment: antihistamines, allergen avoidance versus antibiotic drops, eye irrigation. When distinguishing between allergies and pink eye conjunctivitis, treatment protocols are markedly different. For allergies, antihistamines are commonly prescribed to combat the immune response to allergens, alongside strategies for allergen avoidance to prevent symptom recurrence. Eye drops may also be used to alleviate irritation. Conversely, bacterial pink eye requires antibiotic eye drops to eliminate the infection, while viral conjunctivitis might benefit from eye irrigation and warm compresses to soothe discomfort. For either condition, it's critical to avoid touching or rubbing the eyes to prevent further irritation or spread of infection. Choosing the correct treatment hinges on an accurate diagnosis, as mismanagement can prolong discomfort or exacerbate symptoms.